officially welcome to the NextGen Healthcare Executive Summit. It's powered by C-Suite Network, and we are so excited about being able to really hone in on and discuss healthcare costs. We know this is an opportunity where there is tremendous hard costs, tremendous pressure. And here's the thing, there's actually an opportunity for how we look at controlling those costs and using the opportunity of looking at those costs in a meaningful way to really propel everything forward in terms of our business, as well as how we're supporting our employees and making sure we're taking care of their health as best we can as well. So without further ado, I've got a number of facts I want to share with you, but I also want to tell you just a little bit about what we're doing. So C-Suite Network, I happen to be the Executive Vice President, I'm Tricia Ben, of C-Suite Network. Jeffrey Hazlett is here. I'll properly introduce him in a moment, but C-Suite Network is a place where, and a platform of executive leadership. We are about best-in-class intelligence in terms of how we lead great businesses effectively and really support the acceleration of growth in all the things that we do. And that's operational success, as well as the alignment of our mission, values, and people through all that we do, and how we support all of our executive audience, which is well over 1 million executives every month that we're in direct contact with, let alone our extended network. So the kinds of things that we want to explore today and look at in depth is that there are real gaps, real problems in terms of the healthcare we're able to provide. According to the Commonwealth Fund, Americans pay more for their medical costs than other nations, despite their medical care ranking last against world's leading developed countries. In 2018, 18.2% of our GDP was on healthcare. In 1960, that was 5%. That percentage increase is absolutely phenomenal. And obviously, it's a #1 cost. And I know Jeffrey constantly relates it to us where, when you look at Starbucks, the largest expense that Schultz had was actually healthcare costs, not coffee. And so, there's some real challenges and some real gaps here, and really a sense for us as executives that there's little we can actually do about it. And in fact, that's just not true. And so we want to have this great discussion today where we are going to hear from Nelson, who I will also properly introduce in a second, but we're going to have some great laying of groundwork of how we need to be looking at this whole space as leaders, as executive leaders, with decision-making over what we're doing on our healthcare spend. And then we're going to hear from the most powerful advisor roundtable in terms of actions we can actually take, and why we're missing these pieces that we can be pulling together and making the best decisions for our businesses and for our people. We're also going to have a phenomenal roundtable of our CEOs who are award-winning and really cutting edge in terms of how they are taking the reins of this problem and making an actionable difference that's empowering their business to succeed in so many other ways. So without further ado, I will properly introduce Nelson, who is a friend, part of our family of C-Suite Network, a leader in C-Suite Network as he's brought his whole mastermind in the NextGen Benefits Group over into C-Suite Network and created a space to really leverage the incredible experience he brings to the table in serving this industry and all of the leaders in this space, and making a difference in putting forward strategies that really challenge the status quo and get us where we need to be in terms of leading our businesses and our success. Now, Nelson is also an author, speaker, just a phenomenal consultant, and so passionate about how to make a difference from this perspective. I cannot wait. Nelson, can I hand it over to you to take it away and really help us frame this so that we can get into some great discussion. Nelson?
Tricia, thanks very much, and welcome everyone to this live cast. It is such a pleasure and an honor to be partnering with C-Suite Network, Jeff Hazlett and Tricia Ben and their fantastic team, along with our NextGen Benefits team, NextGen Benefits Network team that has pulled this together. This month in Chief Executive Magazine, there's a 5-page spread on 3 CEOs. You're going to hear from a couple of them today who are using next-gen benefit strategies to control and lower their healthcare costs in a very aggressive way while giving their employees better benefits for less out of pocket. Now, these CEOs are working with 3 employee benefit advisors, NextGen benefit advisors, who happen to be with us today. I want to introduce Allison DePauli, Daniel Abroad, and Michael Hill. Allison with Altique out of San Antonio, Texas, Dan Labroad out with Ovation Health out of Dallas, and Mike Hill with Colebrook Insurance out of Grand Rapids. And also joining us is Deb Alt, the president of Alt International Medical Management. Deb is one of the premier experts on medical utilization management and the NextGen strategies that are making such a difference for employers around the country. So welcome, everybody. I want to get you up, make sure your camera is on. And let's have a conversation about exactly what you're doing with employers around the country. So let me just give a little background. You're all featured in the current issue of Chief Executive along with your CEO clients. And while the status quo in employee benefits continues to work with the head of human resources, NextGen benefits advisors are working with HR to implement the healthcare plan. But first, you all are working with the C-suite, the CFO or the CEO. So my first question for you is, why is that? Why do you feel the need to go to the C-suite to have a conversation around the benefits or the healthcare spend? And let me, who wants to grab that one first?
Nelson, I'll dive in on that one if that's all right.
Absolutely.
Well, that's a great question, and I appreciate the way you brought that up. What I'd like to share with you is it's a team effort working with both the HR team and the C-suite, and frankly, the priorities of HR and the C-suite oftentimes are very different. The HR teams that we work with commonly have way too much to do for the time that they're given in the day. And the priorities that they have in front of them, attracting and retaining key employees, minimizing turnover, building culture within the organization and keeping that heading in the right direction, those are all very important things. And when we talk about making changes to a healthcare plan, oftentimes those run counter to the objectives and the priorities of the HR team. And so when we have a conversation with the C-suite, who is oftentimes focused on the bottom line, or always is focused on the bottom line, if we can help them understand, listen, if we can all come together as a team and take this healthcare plan apart and build the plan that's right for you and your employees, we can return dollars to your bottom line, and we can empower the HR team to do their jobs better if we all work together. But we just need to make sure we all have the same priorities and are headed in the right direction, same direction.
That's a great point. And at the end of the day, it is a team effort because everyone has to agree. Everyone has to cooperate. The C-suite has to provide its leadership. HR has to provide its leadership, because at the end of the day, it's about the employees. And I know you bring the team together to support the employees. Allison, let me ask you, I've heard you talk about having a financial and strategic conversation with the C-suite. What does that look like? What do you mean by that?
I think it goes to what you said earlier, where so many people just consider this an SG&A expense, and there's nothing they can do about it except cut it. And cut it will typically mean harming an employee in some way, higher cost, higher deductible, higher out of pocket, whatever it is. That's not really palatable for anyone. I mean, not only is that not palatable for the HR team, it's generally not palatable for anybody in the C-suite either. But when you have a conversation about controlling the frequency and severity of claims, that changes the equation a little bit. And then they're like, wait, we can do that? Yes, you can do it, and you can do it today. You don't have to wait for anybody to come rescue you.
Dan, when you're working with CEOs and CFOs, what do you find resonates with them? Allison just mentioned the frequency and severity of claims opportunity, being able to manage that. But what else do you find resonates with C-suite leaders?
I think it starts with a different conversation. Traditionally, when we walk in and talk to the C-suite, they haven't been approached by their current broker or any they've talked in the past where it's been brought to their attention, you know, hey, let's look at this from a dollar amount, not from just the benefits. Usually it trickles uphill. HR starts where it brings a budget, says, here's how much it's going to cost. Now, how do we make it work? Now we're going to the C-suite saying, let's figure out what the cost needs to be and how do we get there? And then you bring it back down to HR and help them work out the benefits to get there and implementation. So it's just reverse engineering, really. And they're not used to that. They're not used to having that conversation.
Deb, you are often brought in to work with the employer to manage the utilization of healthcare. And when that happens, you often have interactions with the CEO or the CFO. What have you seen impact them? What has either gotten their imagination or helped convince them that stepping up and taking control of the healthcare spend and the plan makes sense?
So Nelson, my favorite conversation with the C-suite is usually one where I walk in with my tablet and I go, okay, which one of you around this table is willing to admit you've got some medical problem or a procedure coming up? And inevitably one of them will raise their hand and go, I'm going to go get my ACL on my knee redone. I go, okay, where are you going and how did you pick that place? And then I walk them through the quality and cost transparency tools that we use here and show them objective measurements that talk about readmissions, infection rates, complication rates, medical errors, that kind of stuff, and say, here's the score of your doctor. Here are 5 who are better. Here are 5 who are worse. How empowering is this information? Because the biggest challenge that C-suite leaders have, in my opinion, is that we are just like every other American. We think we've got to spend Bentley dollars to get Bentley quality, when in fact we're spending Bentley dollars to get Yugo quality. And we don't understand that the highest quality healthcare provider is inevitably the lowest cost provider, because the fee-for-service system is rigged against the patient and the employer, right? So as we begin to talk about improving quality of healthcare, and then they see, oh, by the way, the highest quality facility, the highest quality physician is the lowest cost facility and physician, a light bulb starts to come on for them. Oh my goodness, I really can control this. And as Allison said, can I control it starting today? How do I get this information into the hands of my people?
So Deb,
can I ask a follow-up question on that?
Sure, go ahead.
So Deb, when you're talking about cost and transparency tools, are those the things that I can just go on Google and I get the reviews from patients on if they enjoyed the waiting room, or what types of tools are you using that's different than a rank and file person like me could use?
Yeah, so these are not Yelp type reviews, right? As much as we all love Yelp for a lot of things, we don't care if the wallpaper in the doctor's waiting room looked like it's from the 1970s. By the way, a world-renowned neurosurgeon who created a procedure that is phenomenal. Anyway, this guy's the best, right? He got a 1-star review from a patient on one of the tools that I looked at because the wallpaper in his waiting room looked like it was from the 70s. That's not the stuff we care about. We want to look at objective, measurable quality outcomes, right? What are their infection rates? What are their nosocomial infections? What are their falls? What are their readmissions? What are their mortality rates, right? If only 1 out of 10 patients survive and that 1 is happy, we never hear from the 9 who didn't, right? So we look at objective, measurable results. Unfortunately, there's not yet, unless some people on this call want to jump in with me and throw some cash down, a consumer reports of healthcare that most normal people can use. My nurses use 28 different quality and cost transparency tools on a daily basis to help patients navigate. It is not possible in today's world for an individual mere mortal patient to do it on their own.
But it is true, though, that just as an employer is using all sorts of research and quality data and pricing data to make a buying decision on steel or some other consumable product for their company, that their employees can be given the same sort of insight and guidance around buying their healthcare.
You just got to bring the right experts to the mix, which kind of opens up your question, Nelson. I mean, if somebody like me, right? I started as a registered nurse. I have a master's in business. I love math and statistics. Don't get me wrong, right? But if somebody like me can figure out who the highest quality providers are, do you think the carriers don't know? Why are they not sharing that information? Why are they not putting that out there? Why are the C-suites not hearing this every day, all day long? To me, that's the thing that is most appalling and most egregious about the entire system. It's not just that their incentives are misaligned, but it's the fox watching the hen house, right? How do you pick your carrier? You pick the one that has your wife's GYN doctor in the network, right? Nobody ever wants to be the one who says, you know, maybe that's not the best choice. So, but you've got to bring the right tools and resources, and you've got to go to the right places to get those.
Well, and let me point out that the reason the insurance companies don't guide or advise or steer employees to the high quality, low cost doctors is they can't contractually. Every doctor in their network is protected from steerage or any indication that one is better than another from the insurance company. So they aren't going to, there's no incentive for them to do it, but they're actually prohibited by contract to do it. Hey, Dan, let me ask you a question. When you're talking to CEOs, CFOs, CHROs, what's the most common objection you get when you lay out this opportunity to make healthcare a controllable cost, but there's pushback? What is that around?
I'll take that one. That is often around the idea that an employee will have lack of robust choices and will be forced to do something that they may not like or may not want. And I would say that then it's not framed properly either to the employer or to the employee. I've framed that in enrollment meetings and had an older gentleman stand up in the middle of my meeting and say, do you mean to tell me that somebody is going to call me and help me and tell me what to do with my chronically ill child and help me get my medications at no cost? And I said, yes, expecting a fair amount of pushback. And what I got was, thank you, finally. And I think that guy was the first one on the phone with them.
So Mike or Dan, what other objections do you get? Because I'd like to get these out on the table, because I know that some of the folks on who are listening and watching are having those very thoughts. Mike, Dan?
Well, I think one of the big things we get is especially when we talk leaving a BUCA or from a fully insured model where it's very simple. I know what my rate is. I pay a bill every month. I'm done. My hands are washed. I don't even see anything. When you're suddenly saying, we're going to unbundle it, we're going to put all these pieces together, it's all in moving parts. And they get very fearful of that. And how much more work is this for me, my staff, my HR staff? Even at a big savings, they worry about the workload. And so I think, being able to guide them and walk them through, even doing baby steps. It's not always hey, we're going to rip off all the Band-Aids at once and throw all this stuff at you. Let's do baby steps. Let's do a little bit. And a lot of times with clients that are coming from a fully insured, it might be a 3 to 5 year process to get them where we want them to go. And it's that hand holding along the way. It can't always be like, let's just jump in and get this done. So they get worried about, you have the employee noise, but then you have the noise from the internal staff that's managing it all. And it can be a little bit scary, but with the right partners and people guiding them, you can take a lot of that away.
So before Mike, I want to ask you the same question, but Dan, is it fair to say that you're meeting the client where they are and walking along the path with them as far as they want to go? So you're not mandating that they do something they're uncomfortable with?
Yeah, it's showing them where they could be, where we'd love to see them, where we think they can go, and letting them choose where they want to start. We just got a new client and they're already halfway there, in my opinion. We're taking them into some next steps that they didn't even know were possible. But they've already started that journey on their own, and now we're just taking them the rest of the way. But then there are other ones where you go in and this is something they hadn't even considered. So now you're showing them the path and the light at the end of the tunnel, and then now you got to build a vehicle to get them there.
Mike, what objections one of the objections that you hear a lot that is some pushback?
I think Dan and Allison did a great job. Those are two common objections that we hear. Another one is And in this kind of current and soon to be post-COVID world, it's going to be a little bit different as well. But the concern had been is, listen, you know, yes, our healthcare costs keep getting more expensive, but the people I'm competing with for employees have the same stuff that we have. And so whether we've got Blue Cross and they've got United Healthcare or whoever it happens to be, generally speaking, healthcare is kind of equal between us and everybody else. And so it's one less thing that I have to worry about or deal with when I'm trying to attract and retain employees. So the concern is so wait a minute here, you're going to take our plan apart and build one from the ground up with you know, players that no one's ever heard of before. That's going to make it more difficult for me to attract and retain employees. And it's a valid concern, 100%. But when we talk about what doing that allows us to do, drive healthcare costs down in the case of Jim and his team at Creative Dining that you'll hear shortly, giving employees the opportunity for 100% coverage. If they go where Deb's team steers them, they can get the service covered at 100% at no cost, and payroll contributions aren't going up. That's a very attractive proposition to share with prospective employees. So it's just getting over that hump and working through the transition, and change is always challenging.
Deb, you've got a great story about a company in Ohio that was in a very competitive job market, implemented a NextGen benefits plan, and was able to put up a billboard. Tell us about that.
So this company stamps out the steel parts for tanks, and 2 counties away is their #1 competitor. So they're constantly bidding on government contracts and going back and forth. And as in most of rural America, their employees will leave and go to their competitor for a 5 cent an hour pay hike, right? They probably spend 5 times that in gas and don't even realize it, but they go back and forth between these 2 employers. So this innovative employer finally said, what if I offered free healthcare? Would I be able to attract and retain the key people that I want and need on my team? Would they stop leaving and going to my competitor and doing this back and forth kabuki dance? So he put in a program like what we're talking about here, told his folks, if you call the nurse and you go where the nurse tells you to go, where she's guiding you, you go to the highest quality, most cost-effective place, we'll waive your deductible and copay. And he went out the next day and put up billboards over a 3-county area where all his employees were, we offer free healthcare, apply online today. And his turnover has gone through the floor over the last 3 years as he's been doing this. As a matter of fact, he has a waiting list of people. When he has a big project, he can call them up and say, hey, we're ready. So it's a very different approach. And by the way, his healthcare costs are 50% of what he was paying in fully insured premiums. And his employees are paying 0.
That's a great success story. So let me ask Mike, Allison, Dan, some of the types of savings that your clients are experiencing when they implement these sorts of next generation benefit strategies.
I think 20% is ridiculously reasonable first year. And then as you layer in tools, because for most people, most companies, it is a journey. It's not an immediate change. We're going to make one change and next year we're going to make another change. You can look at pulling 10% out easily a year and in a few years. And I think Daniel has a great example of this. You can be paying half what you were paying today.
Dan?
Yeah, I think from our experience with clients, especially coming from a fully insured market, 20% is really easy. We typically see anywhere between 20 and 40. And when you start breaking it down, even if a group is, say, already self-funded, we start breaking those pieces out. We'll see 10% saved over here on primary care. We'll see 70%. We just did a group and we're saving 70% on pharmacy. So, you know, looking at what they have in place now, I think every little piece can be different, but overall, I would expect 20, 30, 40%, pretty easy first year on different pieces.
Mike?
I echo what Allison and Daniel have said. And one thing to keep in mind, what a lot of our clients are doing is they're not just trying to pocket the savings, but they're trying to reinvest that in the value of the plan. And so could we potentially squeeze more pennies out of the plan and get the percentage savings higher if we wanted to? Absolutely. But again, I'll point to Jim, who you're going to hear from here in just a few minutes. They chose to make their plan better. So Not only have their costs gone down in excess of 20%, but employees have the opportunity to get care covered at 100%. We're having the opportunity to get very expensive medications that commonly would have a high deductible or a high copay associated with them free for members. So it's trying to find how do we balance the needs of the employer and also the employees and try to deliver value to both. So if you're chasing just big savings, it can happen, absolutely. I don't think that's what any of us are signing up to help you do, but we're trying to find a way to help you reduce costs and deliver better benefits to your employees at the same time.
I think Michael made a good point too about reinvesting. So you go maybe that first year or second year and you suddenly see a big savings and you say, great, and you throw it in the bank and you just have it sit there, or you buy a new boat or whatever the CEO wants to do. But instead you reinvest it for further savings down the road in maybe medical management or something that's going to help drive a better care and lower costs for the employees as well. So you reinvest and eventually you're going to get to a point where you've done everything you can and now it's really, putting more money back in the bottom line for you.
So Nelson, we have a client that's an auto dealership, and they took the savings and put in a new HVAC system that included the maintenance bays of their auto dealership. Have you ever been in a maintenance bay in the middle of summer in the South? It gets hot, right? Talk about heat stroke and exhaustion. He air conditioned it. He said, you all help me save this money on our health care. I'll put it into putting an HVAC system in. Employers are doing all kinds of innovative things with those savings.
I would add that for my clients, I rarely hear that saving money for the employer is the top concern. I mean, this is business and we should pay an appropriate amount of money. But the number one complaint that I hear is we don't feel that our people can use a plan that we spend an awful lot of money on. How do we make it better? That cost savings and significant cost savings are a part of that is almost a bonus. Almost.
So let me ask one of you to respond to this, and whoever gets it first. The HR team plays a mission critical role in bringing this type of plan to the employees. How do you talk to the HR leaders about the value proposition of this plan? Yes, it saves the company money. That's not their primary concern. They don't own the P&L. They're concerned about the employees. So how do you articulate the value proposition to the employees to the HR leadership?
I'll hit that if that's all right. The biggest thing that was the eye-opening kind of life-changing moment for me was 4 years ago or so, having the opportunity to meet Nurse Deb and her team at AIM. And the biggest thing is that, as she touched on earlier, the tools that we would go to online as a consumer to try to figure out where the right place to go are ineffective at best. And when it first kind of dawned on me that, wait a minute, we can actually quantify who's better than who at a particular procedure. And if we intervene on the front end and help the person understand, listen, your doctor's referred you to see Dr. Jones, but they only do that procedure twice a year, where Dr. Smith, 2 streets down, does it 14 times a week. That's an amazing, amazing thing. And that's what we're trying to do. The number one thing that we're trying to do if we manage our healthcare plans effectively is get people better care, reduce the costs out of employees' pockets, and give them the ability to get higher quality care based on objective quality information. That's as simple as it is. If we do that well, the cost savings will follow. It is not complicated. It's like anything else. If you go to a bad mechanic and you get a bad brake job, you're going to spend more money in the long term trying to get that thing fixed. And it's the same thing with healthcare. It is not a complicated thing. And that's what we want when we have the opportunity for those on the front lines that are helping us communicate this to employees. Once they see the tools and experience it with their own 2 eyes, that's all we have to do. And then it's just a matter of getting employees to buy in from there.
So let me ask each of you, as we've talked in my presentation, and we've touched on it a little bit here, the real savings comes from addressing the frequency and severity of claims. And you do that by managing the supply chain of healthcare the employees are using. So Deb, I'm not going to ask you this question because I know the answer. The question is, what is one of your favorite or go-to cost containment strategies to help you manage the supply chain? Deb would say medical utilization management, as she well should. But let me open it up to you advisors. Other than, because everyone here uses AIM in your groups, what other strategies do you all like and feel have a powerful return?
I'll take that first. Well, so AIM is the gold standard and a company that we all use and have received tremendous value from. She asked me the other day if nobody in one of my groups ate fish. I said, what? She said, well, you have this problem, and if everybody ate more fish, this would go away. So that's what you get, right? Where else do you get that? You don't. Besides that, there are all sorts of transparency tools, but RX transparency tools, quickest impact ever. It's immediate. You can see it in the first 30 days.
So the prescription spend, right?
Mm-hmm.
Yep. All right, Mike, Dan?
We just did something for a client. We're looking at their claims data recently. We're seeing this is an aging population, a couple hundred employer group, and they've got quite a few MRI, CT scans, a lot of imaging going on. As we look and see this imaging, we ended up implementing a program where we have a network of imaging centers now. We've negotiated with those imaging centers that if the employee goes there, there's a flat fee, and let's just say it's $400 for these images. Meanwhile, this client was paying anywhere, $1,200 to $2,500 per imaging previously, and the employee had a $250 copay. We tell the employee, if you choose one of these facilities, you no longer have a copay, and so they're happy. They save $250. But now the employer's cost went from $1,250, $2,500 down to $400. So they see that savings. And the employee still has a choice. And that was the first thing. Well, you're forcing them to go somewhere. No, they still have a choice. They can go to the more expensive one, but it's going to cost them more as well. But when you make these other alternatives, and really an MRI is an MRI. And so they're able to save money, the employer saves money, and it reduces the overall spend for everybody. So
you make a great point that I want to drive home. And that is, we're not talking HMO here. As Deb likes to say, most of these plans are making it easy for the employee to do the right thing. But if they want to go to a high cost, low quality provider, they have that choice. They just have to pay out of pocket for the privilege. So the opportunity for them to eliminate their out of pocket, is by directing them to these high value, low cost, high quality providers. Mike, you have what's your favorite go-to or very impactful cost containment tool?
Well, I'll try to make it very basic, Nelson. I try to think of the plans that we're trying to build as a smartphone. And if AIM is the operating system on that smartphone that kind of connects all the pieces together, first you need the piece of hardware to do that with. And a high quality independent third-party administrator that's going to give you all the information that you need, every moving piece in your plan, tell you what's happening and why, and give you the ability to put on whatever apps you want to put on. That's what you need. So for example, if we find out that we're going to Italy next year, I'm going to put a Google Translate on my smartphone and the operating system's going to make it talk. In the case of a health plan, if we find out that we've got incredibly high specialty drug utilization, there's a half dozen different players that we can plug in, and Deb's team at AIM is going to make them connect to the plan and speak flawlessly. And so that's what we need first and foremost, is the chassis to build this thing on. And there's lots of great options out there, but we need someone that's going to let us do what we want to do and give the information we need to make smart and informed decisions.
So let me thank all of you. We are going to be going to a Q&A session after the next roundtable discussion. So I know there are a lot of questions and some comments that we'll want to hear. Be sure, those of you listening and watching, to head with us to the Q&A. It's in a separate room, but all of these advisors will be there and available to answer your questions. So Allison, Dan, Mike, and Deb, thank you all very much. Really insightful, really helpful, I think, to any C-suite executive or HR leader who is listening and watching this. So thanks very much, and we'll see you guys at the Q&A session.